This week on Oklahoma Horizon. Well, while the Supreme Court may have ruled on the Affordable Care Act, the debate over what is commonly referred to as Obamacare is far from over. Today, we begin with what the new law could mean for you and your family.
The highest court in the land has now spoken. We will continue to implement this law, and we'll work together to improve on it where we can.
And I'll sit down with the former CEO of Integris Health to talk about health care, health insurance, and our political system, and find out why he believes we may be getting some adverse reactions to what is being prescribed.
The president said we should only pay for what works. And in that case, he was exactly correct. But to get there, we've got to get to evidence-based medicine.
Stay with us for Oklahoma Horizon.
Oklahoma Horizon is made possible by the Oklahoma Department of Career and Technology Education.
Oklahoma's investment in Career Tech provides more than nationally recognized technology education and training. It produces solid financial returns for the state's economic future. Oklahoma Career Tech, elevating our economy.
And the Oklahoma Department of Agriculture, Food, and Forestry, helping good people grow good things. And now, from the Career Tech Studios in Stillwater, here's your host, Rob McClendon.
Well, by most accounts, history was made when the Supreme Court ruled 5-4 the Patient Protection and Affordable Care Act, commonly referred to as Obamacare, is constitutional. But despite the ruling, there's no indication the debate is even close to over. With Americans evenly split over health care reform, it's an issue that politicians on both sides of the aisle will use as a political club to beat their opponent over the head with. Unfortunately, what gets lost in the election year posturing is, as a country, we still spend almost twice as much on health care as other developed nations, while too many Americans, about 1 in 5, lack health insurance. Today, we're going to look at those issues and visit with an Oklahoman that has some common sense solutions on how to solve them. But before we do that, a little background on how we got here.
With the Supreme Court ruling that the Affordable Care Act is constitutional, steps are rapidly being taken to turn a controversial law into reality. And while the main objective of this new law is for everyone to have health insurance, the question that everyone wants to know is, how does this affect me?
The highest court in the land has now spoken. We will continue to implement this law, and we'll work together to improve on it where we can.
While the debate over the Affordable Health Care Act may go on for a while, many of the provisions in the Act are already underway, while others are set to be rolled out in stages. Already in place, insurers are required to cover young adult children under their parents' policies until the age of 26. Those with pre-existing medical conditions also have a little less to worry about, as some states' public insurance plans are gearing up to give people seamless health care coverage. Insurance companies have also been told no more lifetime limits on benefits, meaning that people with long-term or expensive health problems will no longer have to live in fear of caps being placed on benefits over their lifetime. Rebates are also being distributed to help seniors covered by Medicare to help with extra out-of-pocket expenses, often referred to as the donut hole, where Medicare no longer covers seniors' full medicine costs. And effective January 1, 2014, insurance companies will not be able to turn away, drop, or increase prices due to current or pre-existing health conditions. For the millions whose employers do not provide insurance, there will be federal subsidies to help them afford their own insurance. At the same time, large companies will be required to provide health insurance to their employees. The act will also allow more people to receive Medicaid, and if they do not qualify for Medicaid, subsidies are available to help with costs. And with such dramatic changes taking place in our healthcare system, there will undoubtedly be adjustments as the law is put into place.
When we return, I sit down with the former CEO of Integris Health to talk about what he believes is political malpractice when it comes to health care reform.
You're watching Oklahoma Horizon, featuring some of the good things that are happening in the great state of Oklahoma.
Well, my guest this week is one of the state's most highly regarded leaders in the healthcare industry and the author of the book, Political Malpractice, How the Politicians Made a Mess of Health Reform. Joining me now is the former CEO of Integris Health and now author Stan Hupfeld.
Thank you.
Well, first of all, I've got to ask you, has healthcare become more political or more about politics than it has about health?
Absolutely. You know, we started this discussion about covering the uninsured. That was where we began. And I encourage people to listen to the debate today. We never hear anything about covering the uninsured. What we hear about from the Democrats, of course, is covering pre-existing conditions or covering your child until they're 26, which is insurance reform. What we hear from the Republicans is how bad it is and that the government's going to take over health care. The poor, the uninsured, where we started, have totally vanished from the conversation.
Let me start at the very beginning. Why would I, a person who has health insurance through my employer, and most of my friends have health insurance through their employers, why would we want to change right now?
Well, there's probably only one reason, and that is that the uninsured do impact what you're paying. They do impact what you're paying in premiums. They do impact what you're paying every time you go to the hospital. Because in the past and currently, there's hundreds of thousands of people in Oklahoma who do not have insurance, who eventually show up in hospital emergency rooms, for which policyholders ultimately pay their bill.
I think you said in your book, you know, President George Bush, the son, was derided for saying, well, we do have universal coverage. It's called the emergency room,
right,
which is our most expensive form of coverage.
Absolutely. And people made fun of him for saying that, but he essentially was correct. Now, is that proper care? Is it economically based? You know, that's the argument. But technically, he was correct. That is our form of national health care.
Why is our system, our healthcare system, so different than the entire rest of the developed world?
Well, there's a couple of reasons. To me, it seems we've not decided whether healthcare is a business or whether it's a social service. If it's a social service, is it like police or fire, where it's our responsibility as taxpayers to fund it through some sort of taxing mechanism? Or is it simply an entrepreneurial business and the swift survive? And working on your pricing structure, working on your profit structure is really where healthcare is. We're some of both. And that's what I think makes us different than the rest of the world. Now, there's some other reasons that make us very different. Our insurance system, for instance, is very different than any place else in the world.
Before we get into the insurance, I do want to talk to you about the legal impact, tort reform, and the fear over being sued in malpractice suits. How much of a cost does that have on our medical system? I hear a lot of different numbers.
Well, the Harvard study, which is probably the gold standard, says it's about $40 billion a year.
In comparison to what? $40 billion a year in comparison?
Added cost.
Added cost, okay.
Added cost. The point is that because physicians fear that they may get sued, they overorder. What I point out in the book is that's very true, but it's also in the physician's and in the system's best interest to overorder. The more we do, the more we get paid. And so our economic interest really support our fear of being sued.
So it almost seems like that's an irony, because what you've just described is probably better for the hospitals and the doctors because they make more money by overprescribing.
Right. The fear of being sued actually works to our benefit. It doesn't work to the public's benefit. So it's very true. Here's the interesting part. In 40 years as a chief executive officer of American hospitals, I can count almost on one hand the times we failed to do something. In other words, we didn't order the extra test and something bad happened and we got sued. What we normally got sued for is things we did and we messed up. So the fact is, we seldom get sued for not doing something. But that seems to get lost in the discussion. The fact is that physicians have a fear of being sued. That fear of being sued causes them to order more tests and procedures that need to be done. But also, the fact that they fear that and they do that also works in their economic benefit.
Interesting. You did mention insurance. And that is a large part of our healthcare system here in the United States. What, about 20% of our costs go to health? 25%. What are we doing right? What are we doing wrong?
Well, the first thing, it seems to me, and I go to some great extents in the book to talk about this, is we call it the wrong thing. We call it insurance, and we pretend as if it's insurance. So for you and I, you know, what's insurance? Well, insurance is that you take a little bit of money from the many to pay for the extraordinary losses of the few. That's insurance. So when someone throws a ball through your window at your home, you don't expect your homeowner's insurance to reimburse you for that window. But in the healthcare system, every time we have a contact with a medical provider, we expect someone else to pay the bill. Now, by definition, that's not insurance. That's a payment system. We trick ourselves by calling it insurance to start with. We're paying an organization to take a claim from a provider, to compare it to a benefit package, and to issue a check. That's a claims adjudication process. That's not insurance. And we spend 1/4, 25% of every healthcare dollar, this trillion-dollar business, goes to collecting bills. That's a rich source of cost savings if we were willing to change.
What about entrepreneurship? We've seen the growth in doctor-owned hospitals, doctor-owned surgery centers. How has that figured into healthcare costs?
Well, the problem with physician-owned enterprises is that the opportunity, at least, is to continue the overprescription, to do more than is absolutely necessary. Now, would I accuse physicians of doing that? Absolutely not. Are there physicians who take advantage of the fact that they have ownership in a hospital or an MRI or a CT scan or a surgery center, and as a result, patients wind up getting more than is absolutely necessary? I think you have to say yes, if that's their incentive. So it is a factor. Physician ownership is a factor in the cost conundrum.
What's my responsibility as a patient? What can I do better?
Well, you know, I've talked to a lot of physicians in writing this book, and almost to a person, the physicians talked about the pressure that they're under to do something for patients, even when they know that doing nothing would be better. The fact that patients, when they leave their office, if they don't have a prescription, if they don't have an order for a lab test or an x-ray, feel cheated. And that their dissatisfaction with their doctor is palpable. We see that, for instance, in this whole antibiotic issue. The fact that we put a lot of pressure on our physicians in the wintertime to prescribe antibiotics for what is clearly a viral infection. And that's the most perfect example. So you and I and the rest of the public are clearly part of the problem.
Do you believe that the advertisements we see and the commercials on television play into that role? I've had people tell me in the medical profession that once a big commercial run will start about a certain drug, then they get lots of questions about it, whether the patient needs it or not.
Yeah, the pharmaceuticals have figured this out. And they know that if they go over the head of the doctor and advertise directly to the patient for a prescription medication that requires a physician's authorization, they know that if the patient goes into the doctor's office and says, will you give me XY, will you give me the purple pill, that the physician is 80% of the time likely to write that prescription, because it is simply easier to give you the prescription than to take 15 minutes to explain why you shouldn't get it. And the doctors don't have that extra 15 minutes.
Because they're making money by seeing as many patients as possible.
Well, what do physicians sell? They sell time. That's all. That's their product. And the fact, if they have to take 15 minutes every time they see a patient to explain why you don't need a medication they just saw on the nightly news, that's one less patient they can see.
You know, I don't think any of us like to get old. And does Americans' view on death and aging, has that figured into our healthcare costs?
You know, the fact is that we do die differently in this country. You know, as I said in the book, there's this old saying that the rest of the world views death as inevitable, and Americans view it as optional. And there's some truth in that. So we do lead the world in high-cost care for the elderly. That gets to be a philosophical question, that gets to be an ethical question, it gets to be a legal question. But unquestionably, how we handle our elderly and how we handle death in this country is a great exacerbator of the cost. You know, our tendency is to put our parents at the end of their life in an intensive care unit at the cost of $100,000 a day in comatose conditions rather than let them die naturally. Our tendency is for a terminal cancer patient to get extreme treatment at hundreds of thousands of dollars of cost when they'd be better off with palliative treatment in a hospice care. So dying and how we handle old age is an issue, and it is an issue that does impact cost.
Now, a great part of your book talks about the politics of healthcare, and you're not particularly forgiving as our politicians as caregivers.
Right.
Why is that?
Well, it seems to me that for the most important domestic issue of our time, we've asked the very worst people to decide it for us. And on the one hand, you're right, I'm very critical of politicians. At the end of the book, I do acknowledge that running for political office is maybe the most difficult human endeavor. You expose yourself to such criticism. It costs so much money. It is so arduous. It takes such a toll. So is there any question that once you get there, you'll do anything to stay there? And I think that's where we are. And so, people bringing logic, bringing common sense to the equation is lost, and all we get is, very partisan bickering at the fringes of the discussion and very little conversation about what makes sense in the middle.
Yeah, I remember that part of the book you're talking about, that you lay out three things that politicians think about, and the very last one, is it good for everyone?
Right. And you never get to that part.
Yeah.
Unless you answer the first two, is will it help me raise money? Will it help me get votes?
Yeah. Interesting. When we return, we'll ask the question, does the United States have the best health care system in the world?
Oklahoma Horizon is now portable. Just subscribe to our weekly podcast. Visit iTunes.com, where you can download our show for your listening or viewing convenience.
So, Stan, you say there are several cliches when it comes to healthcare, that things that we think we believe, but they may not be so. First of all does the United States have the best healthcare system in the world?
Well, I do talk about the fact that there are things that we say that almost limit debate and limit an intellectual conversation. And one of those is, well, we have the best healthcare system in the world. Of course, once you say that, you've cut off debate, because why would you change it as if it's the best? So the question is, on what basis would we say we're the best? We do some marvelous things. We have hundreds of thousands of sophisticated doctors, thousands of really wonderful hospitals. But on what basis would we say we're the best? Because according to world statistics, we're far from, but the only thing we lead in is cost. But so in life expectancy and other kinds of measures, we trail the world in most of those.
You hear a lot on the campaign trail that healthcare should only be between you and my doctor, and we don't want a government bureaucrat having anything to do with that. What do you think about that statement?
Well, first off, if you're satisfied with where we are today, maybe that's a good statement. But if you think we can improve, and we can certainly improve on the high cost, you'd have to say, well, that attitude sort of got us where we are. Each of us, I, you, and everybody else, wants a loving, trusting relationship with our physician. But there's got to be some opportunity to follow evidence-based medicine. I firmly believe that one of the reasons that our costs are so high is the variability in the way medicine's practiced. And you look at every study, it varies by as much as 30% between here and Tulsa in certain surgical procedures. And so we have this variation in how people are treated that's unexplained. In my opinion, we'd be better off as a nation if we made a real concerted effort to follow the evidence, to follow what medical schools and professional societies have determined is the best way to treat people, and begin to take variation, this huge amount of variation how people are treated, take it out of the system and only pay for what works. The president said we should only pay for what works. And in that case, he was exactly correct. But to get there, we've got to get to evidence-based medicine.
What about the variation between what one physician will make as, say, a primary care doctor and what a physician will make as a specialist or a specialist surgeon?
Well, there may be as much as 10 times between, with relatively the same amount of training, what a primary care doctor, a pediatrician, a family doctor may make and what a highly trained specialist would make. 100,000 versus $1 million. And with, you know, as I said, basically the same amount of years in school.
Yeah, and a lot of years in school, not only the medical school,
Right.
but internships
Absolutely.
that can go,
Absolutely.
what, 5, 6, 7, 8 years?
And my personal belief is that if you believe as I do, that people that work the hardest, that have struggled enough to achieve something ought to be the most rewarded in our society, then clearly physicians ought to be tops among that, and I really believe that. But we do have to realize is that there is this variation, this huge variation in what physicians make. That variation somewhat stimulates the problem, the cost conundrum that we have. And that variation is historically based. It's because when we started health insurance in this country back in the 1930s, the physicians that really got control of those early payment mechanisms were physicians that did something. They operated on somebody, they put a catheter in, and so you could physically count and calculate what that was worth. And physicians that only spent time with you, family doctors, pediatricians, that was much less valuable because it's much harder to put a number around time.
Now, in your book, you say that Obamacare, the Patient Protection and Affordable Care Act, is important legislation, but it certainly is flawed. What are some of the big things that you think that you worry about?
Well, it didn't touch the whole issue of tort reform. It just sort of passed it by. And I think that's, for me, that was a huge flaw. It's based on some faulty economics. I don't think they were realistic about the economics. For instance, the plan anticipates that some future Congress is going to tax what are called Cadillac plans. And the theory is that there are executives and companies that have better plans than their employees. Well, but Cadillac plans are also, in many cases, union plans. So how are we to believe that some future Congress is really going to tax these plans in the future? The so-called doctor fix was not calculated. You know, we have this process where every 6 months or so, the Congress extends physician payments in Medicare because there was a law several years ago that would have taken those down, so we have to fix it every year. The total cost of the, quote, physician fix is not in the bill. So there were about 4 or 5 things that were not calculated in the bill, which really understated the total cost of the legislation. And you know, the other issue is, are we really going to see coverage of the uninsured? We have this whole controversy now from the Supreme Court is whether the states really have to step up and take on the additional Medicaid coverage. That seems to be a question. A lot of states are saying no, they won't do that. And that was the basis in most cases, how we were going to get to covering the uninsured.
I just saw a study from the Kaiser Foundation that said that Oklahoma, in fact, would be a large benefactor if they got the federal money to cover Medicaid, that we'd probably be able to cover more than half the people that are uncovered right now.
Right. Right. Well, you know,
with federal funds,
yes,
not
yes.
state funds,
well,
federal funds. Yeah.
Certainly federal funds in the beginning.
Right.
The first couple of years, the federal
It's a
funds,
sliding scale.
It is a sliding scale, and you get weaned off that federal subsidy. So ultimately it would cost the state, but it is a good way, if we were serious about covering the uninsured, which is about 19% of our population, if we were really serious, it's a good way to extend coverage to those folks.
Well, certainly an interesting book, Political Malpractice, and a fairly easy read, one that is written for the lay person, and one that I think probably we'd all be well served if we do read it. And I appreciate your insights today. Stan Hupfel, the former CEO of Integris Hospital and author of Political Malpractice.
If you're interested in Oklahoma culture, you can keep up with us throughout the week on the Red Dirt Chronicles blog. Look for the On the Horizon postings on Tuesdays and Fridays, and tell us what you think.
Next time on Oklahoma Horizon, we look at global food security and see how some Oklahomans are hoping to change the world one life at a time.
Production agriculture is what we would consider in the United States as gardening. You know, obviously whenever people have a garden on a half acre, they don't have John Deere tractors and Massey Fergusons, and they do all of their planting and most of their harvesting by hand.
Feeding a Hungry World on Oklahoma Show for the Heartland, Oklahoma Horizon. Well, we are out of time. I'm Rob McClendon. Thanks for watching. See you back here next week.
Horizon is made possible by the Oklahoma Department of Career and Technology Education and the Oklahoma Department of Agriculture, Food, and Forestry. Thank you for watching Oklahoma Horizon.